And we're on the air in 3, 2, 1.
Speedy TV. Live from Paralyzed Veterans of America's Health Summit.
Delivering excellence, achieving state-of-the-art healthcare.
Hey everybody, I'm Tim Pogo for Speedy TV here at the Paralyzed Veterans of America's Summit 2012. We're inside the Paris Hotel in Las Vegas. Now, it's the third and final day of the summit, and today we're going to meet a man who's at the forefront of MS research. Also, we'll talk to somebody with the PVA who does a lot for veteran services, but not exactly in healthcare. We'll also walk around and talk to some more of the summit attendees. But up first, we're caught up with a very busy man who is basically instrumental in setting this entire thing up. And to get things going here on day 3 of the summit, I caught up with Paul Gutierrez. You pretty much ran the show here, didn't you, this week?
Well, I've had a lot of help with that. So I've been very blessed to be privileged to have this honor. I have a wonderful big team that's really done a lot to help us get this program together, to recruit speakers, and to go through the multiple submissions we had of abstracts. And I can tell you some of our reviewers were really tough. They were not easy. So they were tough on some of the presenters. So the people who did make it through that process did a great job, and I think have done a great job with the presentations we've had so far.
How difficult is it to round up all these esteemed and renowned professionals to be speakers and all get here in the same time? Because everyone I talked to, they seem to have about 2 minutes to spare, and then we're off flying off God knows where.
Well, there is a great networking, obviously thank God for email these days. You, through the different people who are very involved in the treatment of MS, the treatment of spinal cord injury, there are great networks there already. And that was one of the ways to get our message out to different people. But it was really an expectation that you would submit an abstract. So there were a few, obviously some of our big plenary sessions were by invitation, but for the most part, anybody who has a really good talk, something that they can convince us is going to be useful to as many people as possible, they have an opportunity to get in and present an abstract and then get selected to be on the program.
And let's talk about the people that heard all those talks, all these clinicians from all over the country and beyond, some internationally, that represent every aspect and every discipline of healthcare, really. On TV, you'll have medical hospital shows where the doctor might not get along with this nurse, or this social worker might not get along with this therapist, right? But in real life, here they all are, all under one roof, working together.
Absolutely. And I think that's one of the things that you get out of, say, the spinal cord injury population and the practitioners that are in spinal cord injury and rehabilitation and neurology in general, is that there is a collaborative focus already. And we're so used to working as teams, that's the only way we can really take care of these very complex patients, that it comes kind of naturally to people to have multiple disciplines and all kinds of different people involved, both listening and presenting. So that's been really wonderful for us.
And have you seen actual real-life connections made and relationships forged and people that have gone off and worked together that kind of collaborated here first?
Oh, absolutely. I've met people at this conference that I had no connection with before. I know of other my colleagues from where I work back in Long Beach who are making connections here. For instance, we're going to be opening up a long-term care unit. Dallas has already done that, so our nurse who's going to be very involved in that has made her connection with the people from Dallas. And it's just a way to find people. I'll also say one of the great things that we're able to do in the MS group is having our SharePoint site for the VA Special Interest Group for MS, and then the wonderful website the MS COEs have. There's different ways for people to connect there. So there's a directory you can find, you may remember, this person was here, but there's a place for you to go and find that directory again, and then find other people who are doing the same thing that you're doing, or that you can draw experience from.
Because if you're like me, you get home from someplace and you're like, oh no, who's this guy again? You look at the cards, it's like, wait, I think I met him over at but there you go.
They have their information. We try to put a little blurb about everybody, what they do, and obviously the program, you want to take that home with you because that has a lot of information in it too, and contact information for faculty. So there are all kinds of different ways to keep connected and to find people later on. So.
Fantastic. And give us your take on the role of the PVA in the summit and just how crucial that relationship is with everybody here and what they do.
Well, if it wasn't for the PVA, this wouldn't exist. This and just say the spinal cord injury centers of care, the MS COEs. None of that stuff would have happened if it wasn't for the advocacy that the PVA has had for years and years, and just the incredible investment they put into this financially, time, their staff. They dedicate so many staff to help us put this together. It's just a wonderful, benefit that we all get. It's one of my favorite affiliations. Occasionally people think that the PVA is adversarial, but really there are partners. And if you let that happen, that you work together with them, and it's just great benefits for whatever center you're at.
And looking ahead to next year, will you be involved in the Summit 2013?
Absolutely. I think I'm staying on as program chairman, and I'm really looking forward to Orlando. That was where the initial summit was, and was a great facility. So we've learned quite a bit over the last 2 years, and there should be some improvements made, and there will continuing to be improvement. We really enjoy the feedback that we get from the people who have attended and the people who have been speakers, because you can always do better, and that's what we intend to do.
Absolutely. Well, hey, great job as the program chair this week. I'm sure you're ready to take a break now. It was fantastic, and thanks for joining us.
Okay, thank you.
Give us your thoughts and your take on the Summit 2012.
This has been a wonderful conference, one of the best I've ever attended. I attended the one last year in Orlando, and it surpasses that. It's been a great conference.
I thought it was a great experience for nurses to be able to come and learn a lot of the new innovative things, that evidence-based practices that we don't get a chance to really read about during our daily day because we work 40 hours a week or plus. So being able to come out to a seminar or a conference where we can learn new things, it's a great experience, so we can better take care of our patients and further our own education.
Summit 2012 is great. They've got a lot of great topics. I like the way you can pick out the topics you want to go to. I picked up a lot of great information, a lot of great speakers, great food, lodging's great. It's just a really great summit. We get to interact with all the different nurses and therapists from all over and get other information and interact and get other information of who does what differently and bring it into my practice if I think it's necessary.
I enlisted in the United States Army, went to Iraq in 2003.
Lance's tank was completely destroyed when it was hit by an IED.
I was an only survivor.
Paralyzed Veterans of America is an independent organization dedicated to ensuring our injured veterans get all the benefits they've earned and need.
I'm willing to do whatever it takes to serve our veterans.
If you would like to help our veterans, visit pva.org.
Speedy TV, a service of Paralyzed Veterans of America.
To kick things off here on day 3 of Summit 2012, I'm with Dr. George Kraft. He's a professor at University of Washington, Seattle, and a well-known expert in MS. So welcome. Thanks for joining us.
Thank you very much. It's a pleasure to be here at the meeting.
And first off, describe your thoughts on the summit and your involvement.
Okay, well, I'm really, really pleased to be invited here. I was invited by the MS Centers of Excellence, which are participating in the meeting with the PVA. And as you know, today being the third day is the day that the COE, Centers of Excellence, sponsored the program, and I was invited to be the Whitaker Memorial Lecturer for the plenary session.
And to talk about that relationship with what you do in the PVA and how important that
I think
partnership is.
Let me go into a little bit of history because I think it's really interesting. So there was a lot of interest in the PVA for MS because many of the new members have MS. And so they went to Congress, and Congress set up a special committee, an expert committee, to determine how can the VA manage all these MS patients. And I was privileged to be on that committee, and Dr. John Whitaker was also on that committee. And sadly, during our deliberations of over maybe 8 months, he was riding his bicycle and hit a car door, and he was killed. And so we wanted to honor Dr. Whitaker and have a special lecture in his honor every year. So I think that's important background to understand that this is a very important and serious meeting, and I'm going to talk about MS in a very special way. What I've been trying to do in the research is do something that I think hasn't been done elsewhere. It's to really get inside the brain and the mind of somebody with MS. because people with MS can look really good, they can walk well, they can speak well, but inside their brain they have fatigue, they have pain, they have cognitive impairment, and they have depression. And that is like a witch's stew, a witch's brew, and those symptoms feed on each other, and they all need to be treated. And if you treat one without the others, you don't get much benefit. So I want to help people and the people taking care of MS patients to really kind of understand what it's like to have MS, and especially what I call these hidden disabilities and how to manage them.
And those are all conditions that you mentioned that you can't just do one thing to treat them all at the same time. In each individual one requires its own attention. Right?
That's exactly right, and I really want to stress that.
And describe for us then the relationship with spinal cord injuries and MS, and how especially this week, it's really you really see here at this the summit how efforts are kind of combined to tackle them.
Yes, that's right. Well, they do. There's overlap. And patients with MS can have MS lesions in the spinal cord. In fact, that's also something that people sometimes forget happens. It isn't just in the brain, it's in the spinal cord. And often the spinal cord lesion is causing the biggest problem. So patients with MS can actually behave, and their functions can behave like somebody who has a spinal cord injury. And I think in Dr. Waxman's talk yesterday, we heard him talking about also the MS lesions in the spinal cord and how that does overlap with MS, with spinal cord injury and MS. And research in one helps the other. And in both cases, we have situation where the nerves are damaged. In spinal cord injury, it's by injury. With MS, it's by the disease. And how we can enhance the probabilities of that area of the cord to function better.
Now, is this a fairly recent realization that MS is related to spinal cord injuries, or is this all news? Or
I think it's really new news. I think those of us who've dealt with these conditions have understood this, but I don't think the general population understands it. And I think probably the PVA understands it because they have now incorporated MS into their program.
And I guess those two sides sort of realizing, oh wow, there's a lot of similarities here. That kind of is also one of the themes here at the summit. You get so many people from so many different areas and disciplines all together in one room and exchanging their ideas and their theories, right?
That's correct. It's very important to get together with the spinal cord injury research group because I think we learn from each other. I certainly learned from Dr. Waxman's talk, and I hope that some of the people with spinal cord injury will learn from the MS talk.
And you've had a little bit of a crystal ball here or something like that. What as you look at your research and the work you're doing and others, what do you see down the road? What maybe developments and breakthroughs?
Well, I think in many ways we can. I don't want to use cure. The term cure is really dangerous in medicine, right? But we can certainly markedly enhance and change the course of patients with MS. I have also been involved with stem cell transplants in MS. In fact, the first stem cell transplants in North America were my patients in 1998. And we transplanted 26 patients during that research group study. And basically, we know that MS is caused by an immune attack on the nervous system. So the body's immune cells are attacking the nervous system. And that's triggered. There's a trigger to that attack. And we know that if we sever that link, there will be no attack. And so we take patients' own stem cells from the blood, freeze them, give the patient massive immunosuppression, and then put the stem cells back in. And the new stem cells then will form new blood cells, and they seem to form them without that attack, this attack molecule, whatever. It can be different things. And that has been very effective for a period of 3 to 4 years. So patients who have not been able to be controlled with regard to their disease activity with standard medicines have been off of all medicines for 3-4 years. That's about as far as we've gotten into this study.
So it's getting there.
It's getting there.
All right.
So it's not a cure, but it's a huge leap in the treatment possibility.
Well, Dr. Kraft, thank you for the work that you do, and thank you for taking some time. Appreciate it.
Thank you very much.
Well, there's a wealth of things I have learned. It's almost hard to put it into, a 1 minute or 2 minute answer. However, from the Botox injections for the bladder control to the different wheelchairs, and even just the ability to compare prices for affordability. You may have 100% disabled vet, and then you may have one that is 0% connected.
A lot of ways that my coworkers could apply telehealth principles and concepts into providing better care to them and quicker access.
In fact, this morning was a great conference in the morning course from a great doctor who put it all in real easy perspective of what happens with multiple sclerosis and what things to look for that aren't normally identified. So it just made a whole new light on that for me.
We've got an entire generation of men and women who have seen war. They're going to need voices.
Paralyzed Veterans of America represents them.
We're going to make sure that the Veterans Affairs gives them everything that they're entitled to.
Changing lives, building futures. That's Paralyzed Veterans of America.
Speedy TV.
Live from Paralyzed Veterans of America's Health Summit.
Delivering excellence, achieving state-of-the-art healthcare.
Speedy TV.
Back with more of the PVA's Summit 2012 here in Las Vegas. And I've caught up with Mark Lichter. He's a DC-based architect. In fact, he's an architect with the PVA. Welcome, sir.
Thank you very much. I'm glad to be here.
My first thing I wonder, though, is what's an architect doing at a health summit?
Well, we at PVA, we're the only national service organization with a team of registered architects, and we collaborate with the VA on all of their healthcare facilities that have anything to do with spinal cord injury, whether it's inpatient, outpatient, therapy areas. So we have a particular expertise in SCI centers and healing environments.
So I guess that just illustrates the point that so much goes into this sort of research and care, and I mean it's we've met guys that are doing these groundbreaking medical advances in molecular level sort of science, but then there's also these practical things.
Absolutely, absolutely, and we try and keep up with the state-of-the-art aspects as well, and that's why I'm so excited to be here. That's the theme of the Summit 2012, and we are on the cutting edge of many of the state-of-the-art aspects of delivering healthcare environments. And as an architect, it's very exciting. There's so much research being done about facilities that are healing environments. As I said, they can really influence the outcomes of patients, and that's just so exciting.
Talk about some of the facilities you've worked on. Is it only healthcare facilities or other sorts of buildings as well? Or?
We work on all sorts of buildings. As a PVA architect, we work on public buildings for accessibility, accessible homes, really anything having to do with making things more accessible for wheelchair users. We are primarily here for the healthcare facility aspects of our work.
And talk about your role in this myriad of people that are here. I mean, you got clinicians from every sort of discipline. You've got doctors, you've got architects. Talk about how exciting that is to sort of collaborate with all these sorts of people in one place.
Oh, it's hugely exciting, and as I go through my day, these last several days, I know so many people here from all the projects I've worked on with them. What we're trying to do here, and the reason that I'm here, is to bring healthcare professionals and clinicians into the idea that architecture can really influence their work, and we're trying to enlighten them on the importance of a healing natural environment.
So you've been to the summit a couple years now. Maybe speak on about how you've seen it grow already so quickly, and what you might see down the road in terms of the sort of things we can bring out of this summit and new ideas and new breakthroughs.
Well, I have definitely seen it grown over the years. This is fantastic the way this year turned out. Large turnout of attendees, huge collaboration. People seem to be very excited about being here, talking amongst themselves and interacting quite a bit. I know that one of the goals for PVA is to bring people together that might not otherwise be able to do so. So I see therapists from one part of the country mingling with therapists from another part of the country. It's almost it's a networking opportunity for them. And really the best way to deliver quality healthcare environments is to collaborate, because there's so many lessons learned from everybody, and That's what I really see as the positive aspect here of the summit. In the future, I just hope it continues to grow, and it will continue to be very timely. I think staying on the cutting edge is going to be very important. It seems like everybody is bringing state-of-the-art aspects to the table here. They're bringing their expertise, things they've learned, and it's very exciting. It's really the best way to keep up with what everybody's doing and to stay ahead of the curve.
Excellent. Well, Mark, thanks for joining us. Keep up the good work, and we'll see you in Orlando next year, huh?
I appreciate it. Take care.
Back with more from PVA's Summit 2012. I'm with David Fowler, David Zerflu. They call him the Dave Squared around here. How's it going, guys?
Very good. How are you doing?
Not bad. First of all, just tell us your general thoughts on the Summit this year and how's it been going so far?
So far, it's going pretty good. We've had more people this year. I've heard a lot of excitement from folks that are attending it, and I think they really think it's educational and beneficial.
Yeah, I'd have to echo what he said. More people have been very impressed with the breakout sessions, the vendors. I think all in all, it's going to be a real big success.
It's been a couple years now since it's been the PVA's own event, right? So it's already grown since last year, hasn't it?
By leaps and bounds, and I expect next year to be bigger and better.
So you guys have a lot in common, right? I mean, you're obviously both vets. You're VPs with the PVA. You're both quads, but different sorts, right?
Right, and I'm better looking.
That's the one main difference, right?
No, my level of injury is from the shoulders down, and it's more complete.
It's debatable whether he's better looking or not, but to give a quick history, when I was first injured, I couldn't move anything from the neck down for 3 weeks. It was a 4-year process to get to where I am today, and I call myself a vertical quad. Yes, I'm on my feet, but I still have the same disabilities, complications that quads have.
So tell us about maybe some of the issues that vets face when they come home and the sort of things that the PVA works really hard to help them out with.
I think we work hard to basically bust them out of their own, for lack of a better word, the prison that they built up in their own mind of the limitations that they have in the rest of their life. You know, my life is over. I don't know what I'm doing. Paralyzed from the shoulders down. What is it that I can do out there? What can I contribute? And we try to show them that there is life after an injury. Not only a life after an injury, but a very potential for a successful life.
Dave, anything to add to that?
Yeah, just to echo what he said, and I think too many people focus on what they can't do, and you need to focus on what you can do. The can'ts are obvious, but when you can find out what you can do and focus on that and set goals, I think life can be very beneficial, and that's what we try to tell paralyzed veterans.
I think you're two perfect examples of that because, like you said, at first you couldn't do anything when you knocked down, right? And then as weeks months went on, you got a little better. You are engaged in all sorts of actual activities, and you're outside and you're doing your old hobbies, right?
Right, and you know, for 6 years, I built that prison, those walls around me. That was, I'm feeling sorry for myself. The world's not accepting me out there, and that was my own prison that I built up, and I busted out of that wall, and hey, the world was welcoming to me, and I made the best that I could out of it.
And what are some of the things that you actually get out there and do?
Oh, it's limitless. I do everything that I did before I got hurt. I just do it sitting down. You know, hunting, fishing, skiing, bowling, sports, soccer, wheelchair soccer, work, school. Basically, I've gone back and done everything.
Same with you, Dave?
Same with him, and I've had to learn to overcome and adapt too. I used to be right-handed. Well, I don't use my right hand anymore, so I had to learn to do things left. It's actually beneficial because it gives you a different perspective. And like him, I mean, when I couldn't move or when I was in a chair, I remember those experiences, and I use those to my benefit to relate to people and to gain perspective and then to help them realize that, yes, I was in your position once. You can do things, and these are what you can do. Don't focus on the can't. So.
You know, and technology has just opened so many doors for us, from wheelchairs to computers to adaptive equipment. in general, the doors are open.
I was just about to ask you that. Being here at the summit with all these amazing minds that are out there doing this research and making these breakthroughs and developments, what do you guys see maybe the future down the road in terms of what they'll be able to accomplish?
You know, the breakthroughs are coming through every day. It's going to be a very individualized concept. What may work for one new injury may not work for the next guy. But I really look forward and I'm excited to see what's going to happen. I believe that there is a very bright future for our guys. Good example of that is when I first got hurt, they didn't have the steroid shots to stop the swelling. And that has helped a lot of guys regain function that wasn't available when I got hurt. So that's just one short example.
And to echo that, I took advantage of the steroid shot. I was one of those new injuries. And I think that's improved. And what I see is individually, there's a 180 change now. Generally, medicine tried to catch the majority of people. Well, now they can individualize it through apps, through technology. I think in the future, individualized care is going to get so much better. It's going to help the veteran and the future injury to improve and excel at healing.
You guys are from different parts of the country, right?
I'm from Texas, hot and humid.
Seattle, very mild. And yes, it rains a lot in the wintertime, but the summers, we get hardly any rain.
From a vet standpoint, then, well, besides maybe better coffee, maybe better barbecue, are the same issues being faced by vets all over the country, and also for any vets watching? I mean, also elaborate on the fact that there's the PVA's out there nationwide, isn't there, to help?
Yeah, PVA's out there nationwide. Basically, all the vets are they have access, no matter where they are in the country, to get what they want. I'd say one of the areas that limits us down in the heat is getting out in the summer because as a quad, we tend to have problems with our body temperature and regulating it. So that's an issue we face down there that maybe they don't face up there in Seattle like we have to.
Until we come out of our nice climbs, because being a quad, I do suffer from heat, and I only sweat in one half of my body, so it's pretty hard in hot weather like this, or down south where it's humid. I suffer a lot. So.
And for anybody who maybe has been injured, vets out there, I mean, that hasn't gotten involved yet with PVA, I mean, what do you tell them? What do you say to them? Did they just call up their local rep and say, hey, and just start that relationship?
Absolutely. Find out a PVA office or a member in the area. It's very easy to do. We have 34 chapters across the country, and many of our members do reach out into the areas. I know we have areas that we go into, what I call dog patch Texas. We'll go into the small towns where the vet may be there and not know about us and try to make ourselves aware. PVA, we're working on getting our name out there.
Yeah, I advise veterans to get with their local chapter, and Dave and I are liaisons for 9 chapters, and we encourage them to talk, get other PVA chapters to talk to one another, learn ideas, improve ideas, and go out and find those veterans and get a hold of them and give them the help they need.
All right, well, Day 3 is winding down here at the summit, so all set for 2013 summit?
Looking forward to it. Should be really good, and I'm looking forward to hearing what the new speakers are going to have to say and the breakthroughs that are going to be made in just a year.
I look forward to learning every year. It's nice that they adapt new techniques every year, and you learn little trinkets every year. It's hard to get everything in one fell swoop, but if you keep coming to these events, you learn more and more.
Absolutely. So. Well, Dave, gentlemen, thanks for hanging out. Appreciate it, and enjoy the last day here at the summit.
Thank you very much.
I think the PVA is a great company, a great nonprofit company. I love the fact that they are supportive of nurses, supportive of all the specialties behind, the clinicians behind spinal cord injury, because it's very much needed. There are so many avenues with spinal cord injury that you need to have companies like the PVA to back you, so you can come to conferences like this, so you can always be up to date on the most evidence-based type information.
So the PVA plays a great role and an importance, and especially for our SEI veterans or our MS veterans, in supporting them and facilitating their access to care.
PVA is just a great advocate for the veterans with spinal cord injury and disorders. They provide such valuable resources to us, their clinical practice guidelines, education.
Good morning. I don't want people to do things for me, try to do them myself. And I don't want no one to look down on me. I was on the way from Kandahar to Kalat, hit an IED that just took the truck and threw it up in the air and slammed it on the ground.
Bye-bye.
I knew at first that I got hurt pretty bad because I couldn't move my legs. I sat home alone for months. And I didn't want that anymore. I wanted to go back to work. Hello? It's him. I was hesitant at first, because I didn't work for a good year. I want to be a productive person. I don't want to be a drain on society. I want to be a positive thing in society. PVA helped me write my resume, got me a job interview.
Well, let me show you to your office.
I got the job.
Helping veterans like Eric is what we've done for over 65 years. Paralyzed Veterans of America, paving access for veterans' employment through Operation PAVE.
Speedy TV,
Live from Paralyzed Veterans of America's Health Summit.
delivering excellence, achieving state-of-the-art healthcare.
Speedy TV.
Hey, we're back with more of Day 3 of the PVA Summit 2012, and just met two more of our sponsors, Steve and Courtney. Men's Liberty is their company, and welcome to the Summit 2012.
Thank you. We're really happy to be here.
Excellent. How's the experience so far for you guys?
Making a lot of new friends, meeting a lot of people that we can connect with and help the lives of our veterans, and we're very excited to know a lot of contacts throughout the VA system as well as in the VA. Because as new partners, it's important to make those connections, and it's definitely happening for us.
Absolutely. I mean, real quick then, let's give everybody the background. Like, what's Men's Liberty all about?
We manufacture external male urine collection devices and catheter securement.
Okay. And that's sort of something that, that you may not first think of, whatever, but if you're someone who's injured, that's a top priority, isn't it?
It is, and it takes over a person's life how to manage that one issue. I mean, we understand that the goals for the Paralyzed Veterans of America, one of the high goals, perhaps the number 2 goal, is to take care of urinary management. There's, for what it is, there's still not any great solutions around, except that we believe we have the best, and we want to help.
Well, you probably are, because when I heard the facts and figures, you guys are batting 1,000 pretty much, right?
Thank you, yes. We've met a lot of people who have been really excited to see what we have.
Yeah, we've actually sold over 1 million units with no attributable UTIs. So it's a pretty safe product. In fact, oddly enough, we surveyed all of our internal customers and found that a lot of our guys were competing in the wheelchair games in Virginia. And doing a little more research, we found out that our mission and the mission of the PVA kind of lined up pretty nicely. And that's to give the quality of life of our veterans, to improve the quality of our life of our veterans. Same as PVA.
Absolutely. Mission Able is that branch of the PVA's efforts that, their mission statement is care, benefits, and jobs. And does that fall right in line with the scope of your company?
Yeah, absolutely it does. I mean, we don't consider our product just to be something that sits on the shelf and somebody uses it like another medical product. It's just a thing. It really does change lives. I mean, people tell us, it changed their life 1,000%. People that were stuck at home couldn't get out.
I'm sorry.
You go ahead.
In fact, one of the guys that use our product, who was competing in the PVA, we talked to his mother, a caregiver of that guy, and she said it improved the quality of life of her son 1,000%. It allowed him the opportunity to get out of the house and go out and do things. In fact, in being at the PVA, the wheelchair games, we found that there was a number of veterans using our product, and our product allowed them to compete in those games.
And not only that, but they're really, really happy to tell their friends about it because it's changed their life. And so the networking that happens in the PVA events is also important to get the word out.
Mm-hmm. Yeah. But that's why they have summits like this. That's why we're here doing this, right?
That's right.
And that's why we are proud to be the newest Mission Able sponsors.
And that's a huge point, right? I mean, because it's those sort of partnerships and common goals, right, for an organization like PVA, for yourselves to get. How important is that to get involved with them?
Well, as Courtney says, we've really found out that we align very much with the goals of the PVA. And, you know, our product helps men so much that adaptive athletes of, whether they're in PVA or not, we're also sponsoring them, you know, because our product actually gives them a lot of freedom. That's why our tagline is Men's Liberty, the freedom to live. Okay, and because it really does make all that difference to them. So it's really, actually, when we come to these events, we actually really do get really excited.
Yeah.
Okay, because we're changing people's lives, and we really are.
No, and urinary incontinence is a real issue, especially for guys in chairs. You know, our product allows these gentlemen to get out of the house and be able to do everyday functions that they would not have been able to do had they not found a product like ours. So we're giving them the dignity, quality of life, and just an opportunity to go out and be a productive citizen again.
You're seeing with all those units sold, over 1 million, no urinary infections. That's a staggering number because they're very much at risk for that, aren't they?
Very much at risk. I mean, the alternatives for them are Foley catheters, where you're certain to get urinary tract infections if you wear them for more than just several days, on especially over months. You are going to get a urinary tract infection, and they're very dangerous. They really are. And with condom catheters, if they work, because they have a tendency to pop off and be unreliable, but even if they work from that point of view, they cause serious skin breakdowns, serious damage to the tissue, erosions of the penis, and urinary tract infections also. So, you know, against that, we have a product that is safe, highly effective, very reliable, and lets people really enjoy their life again.
Excellent. All right, Steve, Courtney, thanks for hanging. Keep up the good work, and we'll see you at the Summit 2013, huh? How about that?
We can't wait.
All right.
We'll be
in
there.
Tampa. It's in our backyard. We'll absolutely be there.
All right,
Nice
thanks
to
a lot,
meet you.
guys.
Thank you.
Now I'm with Eduardo Oyola Rivera. He's one of the VPs with Paralyzed Veterans of America. And, okay, so I know there's a lot of Spanish-speaking vets out there, right, Eduardo? So maybe I'll ask you a question, and then you can maybe answer it in Spanish, or maybe English first, and then answer it in Spanish. How about that?
That sounds good.
All right, cool. As we wind down here in day 3 of this year's summit, give us your overall thoughts so far on how it went down as an organizer with the PVA, but also as all the other vets that are here as attendees, and what you may have gotten out of it personally and learned.
We just have personally learned that this is a must-do for the community in medical field. First of all, we need to put all these professionals together, and in doing so, we do the research, we do the community service, and the veterans out there will get the benefit for it, because the people that we train in here are going outside and going out there, and they will, collaborate with all the medical professions, and not only VA, but also the community itself. La versión en español, les quiero decir que este summit que hemos puesto together o juntos para todos ustedes es para que darle una versión de qué es exactamente lo que se hace aquí con nosotros en esta comunidad, para beneficio de todos los veteranos especialmente, y no solamente los veteranos, pero también toda la comunidad médica que existe en todo Estados Unidos. También ponemos juntos programas que van a ayudar a los profesionales médicos cuando vienen a este summit en su entendimiento. Aprenden muchas de las cosas y mucho de la research que se hace diariamente para combatir ya sea MS, que es multiple sclerosis, ya sea parálisis, que es SCI, and dysfunction, que es disfuncionamiento de la médula ósea.
All right. You know, an event of this magnitude, can't imagine the amount of planning that goes into it. So I wouldn't be surprised if 2013 Summit is already starting to get into the works. So tell us what you're thinking about for next year, and if you're already excited for Summit 2013.
I'm sure. I'm very excited for this 2013 Summit because simple reason. Since we continue doing research in all the medical events that happens, new developments exist and new developments, new what do you call it? Bans, technologies, and they've been put in place to combat this. As I said before, the MS or multiple sclerosis, or the spinal cord dysfunction. Para el 2013, yo estoy muy con la completamente seguridad de que lo que se está poniendo juntos son todo ese research que se ha hecho y se continúa haciendo durante el año para poder presentar a estos miembros que vienen a este summit, darle las nuevas ideas que hemos descubierto, el nuevo research que se ha hecho acerca del MS o multiple sclerosis y el spinal cord.
Gracias. Cerveza? Those are my 2 Spanish words I know. And that's going to be it for our Day 3 coverage here on Speedy TV of the PVA's Summit 2012 here in Las Vegas. It's been an incredible time here this week. We got to thank everybody from the speakers to the clinicians, to the physicians, to the organizers, and especially to the vets for taking time to join us and talk to us here this week. For more info on all the PVA does, please visit their website, pva.org. I'm Tim Pogo for Speedy TV. Thanks for watching, and we'll see you at Summit 2013 next year in Orlando. See ya.
Speedy TV,
a service of Paralyzed Veterans of America.